Next tonight, a North East man who is living with long COVID says it's left him feeling abandoned, with the condition no longer attracting the attention it deserves.
Andrew Haley was among many who caught the virus at the very start of the pandemic. Within months, he was experiencing a number of debilitating symptoms.
He is far from alone, and tonight, to mark 5 years since the start of the first lockdown, we explore how the long-term effects of COVID can impact everyday life.
Our health correspondent Helen Ford spent the day with Andrew at home in Newcastle to hear his story.
I wake up after about 10, 11 hours sleep, and then it's a struggle. That's when the fatigue kicks in. It's as if an invisible person is just pushing me back on my shoulders, back into bed.
At one time, Andrew Haley would be up before 5 in the morning to start a 12-and-a-half-hour shift at work. These days, he surfaces around 10. It is, he tells me, one of many profound changes he's been forced to come to terms with as a result of long COVID.
It's like I'm living the life of somebody else. How did I do them 12-hour shifts? But they were so easy. And now, trying to get out of bed, the simplest thing of getting out of bed is harder basically than doing a 12-hour shift.
Long COVID is an umbrella term which refers to a range of prolonged symptoms experienced by people who've had the virus. For Andrew, debilitating fatigue has been coupled with respiratory issues, along with brain fog and anxiety.
That's one of the big things about I'm struggling with. It's the emotional side, the mental health side. I keep going back to where I was, and then reality kicks in and where I am here now, and it's just it's upsetting.
As a result of his symptoms, Andrew reluctantly took early retirement 3 years ago and now spends virtually all his time at home.
This is me haven, even though it's me prison, it's me safe haven as well.
He tries to maintain some sort of routine, though the weekly house clean, which used to take 3 hours, is now spread over 3 days. Then at lunchtime, Andrew says he has no choice but to sleep for an hour. Andrew has previously received treatment at a long COVID clinic and is now seeing a specialist to support his mental health. While he doesn't fault the care he's been given, he argues that long COVID more broadly is no longer attracting the attention or investment it deserves.
I feel like I've been cast aside. It hasn't gone away. There is sufferers, and there's a lot more people worse off than me that have long COVID, and it's essential that we find out. COVID brought this country to its knees, virtually, and I just think it's been swept under the carpet. Certainly long COVID.
And in the experience of one man living with long COVID, where hours once flew by, time now ticks slowly.
So as we get to the end of the day, what are your thoughts?
Sounds strange, but with the exception of making phone calls to family and friends, it's the best feeling of the day for me. Because I'm able to just sleep, because that's what my body tells us.
Andrew Haley is living a shadow of his former life. At the moment, he says, that shows little sign of changing.
So that is one story, but how many people are living with long COVID? The answer is we don't know. There's far less testing for COVID now, so people may not realise they've had the virus. Even so, a recent survey sent to more than 2 million GP patients in England provides pointers. It asked respondents, would you describe yourself as having long COVID? In other words, symptoms more than 12 weeks after an infection that aren't explained by something else. Across the North East and North Cumbria health area, 5% of respondents said yes, with 10% saying they didn't know. And in the NHS region incorporating North Yorkshire, 4% said yes, with 8% unsure. I've been speaking to a consultant from Newcastle Hospitals who works with several organisations on long COVID. She says while initial infections are often milder now, the long-term impacts can still be devastating.
It can still go on and cause long COVID in a significant amount of individuals, and unfortunately the research also is very clearly showing us that the more times you get repeatedly reinfected with COVID, and you can, and people are, that cumulatively increases your risk of developing long COVID.
Dr Duncan has this warning.
Long COVID rates are continuing to rise, and this is our working age population. This is our workforce that's being disabled, and that's going to have a huge impact not only on the individual and their family but also on the economy as a whole.
All this comes as support groups have expressed concern over the future of long COVID treatment. The Department of Health and Social Care says it's invested more than £50 million into long COVID research. It told us it's committed to ensuring there are quality services for people suffering with it in every part of the country, adding no single treatment currently exists for long COVID, which is why we have funded research into the condition. 5 years from the start of the pandemic, and the health system is still grappling with COVID's consequences.